How does a Placido disc create corneal topography maps? Imagine shining a pattern of rings onto the surface of your, and then studying how those rings bounce back. That's essentially how a Placido disc works to map the shape of your cornea. The Placido disc is a simple yet powerful tool used in examinations to create detailed images of the front surface of your. It helps eye care professionals understand the curvature of your cornea, which is vital for diagnosing conditions and planning treatments. The device itself is a disc with many black and white concentric rings. When a patient looks into a special instrument, the disc is illuminated, and the rings are projected onto the front of the eye. Because the cornea is curved and covered by a thin tear film, it acts like a mirror. The rings reflected off the corneal surface and bounce back toward a camera positioned in front of the eye. This reflection is what the system analyzes. The way the rings appear on the cornea tells us a lot about its shape. If the cornea is perfectly round and smooth, the reflected rings will be evenly spaced and perfectly circular. But in real life, many corneas are not perfectly spherical. If the cornea is steeper in some areas, the rings will appear closer together there. If the cornea is flatter, the rings will be spaced farther apart. When the cornea has irregularities like scars or conditions, such as keratoconus, the rings become distorted or irregular. The camera captures these reflected images of the rings, and specialized software steps in to analyze the pattern. It measures how much the rings are distorted and how their spacing varies across the surface. Using this data, the software creates a detailed, color-coded map of the cornea. These maps can show the average curvature, local changes, or the elevation of different areas on the corneal surface. The resulting images help doctors see exactly where the cornea is steeper or flatter, which is crucial for diagnosing issues and planning treatments. This process is quick, non-invasive, and provides high-resolution images of the front surface of your. It's especially useful for detecting early signs of corneal diseases like keratoconus, evaluating the cornea after surgery, fitting contact lenses, or preparing for procedures like laser vision correction or cataract surgery. Keep in mind, however, that the Placido disc only maps the front surface of the cornea. It does not provide information about the back surface or measure corneal thickness, which other imaging technologies can do. While it has some limitations, such as missing deeper layer abnormalities, the Placido disc remains a fundamental tool in modern eye care. It helps ensure that treatments are based on accurate, detailed information about the cornea's shape. Understanding the surface of the cornea is important not just for eye health but also for ensuring accurate intraocular pressure measurements in glaucoma management and maintaining overall visual quality. If you're considering eye surgery or have concerns about your eye health, your eye care professional might use a Placido disc to help guide their decisions. Always consult with a qualified eye specialist for personalized advice and interpretation of your corneal topography results.